Again, once we go back in the lab, you want me to point out on you, I can show you exactly where it is. Greater trochanter. Iliac crest is going to be nice and high up into the torso. Greater trochanter is going to be much lower down. Ischiotuberosity, that bone deep down into your butt, underneath your gluteus maximus. Gluteus maximus is your butt muscle. Ischiotuberosity is the butt bone that's way underneath it. Humerus, upper arm bone. Remember, very important, palm forward for all forearm and elbow palpation. Medial epicondyle, that bone that sticks out medially. All right, just rub your hand along here, you'll feel the bone that sticks out. That's your medial epicondyle. Lateral epicondyle, a little more difficult to feel because you're on the lateral side, underneath this muscle group, your wrist extensors, where it attaches into. The bone on the outside is your lateral epicondyle. Olecranon process, tip of the elbow, olecranon process. Palm up, radius is the bone on the thumb side. Bone on the thumb side, kind of like your fibula, can't feel it very well except where it comes down into the wrist. Ulna, pinky side, or like your shin bone, larger, you can feel a bit better. Ulna is going to be on that pinky side. Radius thumb side, ulna, pinky side. MCL of the elbow, remember, medial epicondyle towards that olecranon process. These two bones attaches the two of them, so it's right in there in that little groove. Also where your ulnar nerve can be found. Biceps, triceps, wrist flexor muscle group. Wrist flexor muscle groups be on the medial forearm. Goes from your medial epicondyle down into the wrist. Wrist extensor muscle group. Lateral epicondyle, lateral wrist, down into the lateral wrist. Lateral forearm into that lateral wrist. Anatomical snuff box. Remember, this is where your scaphoid bone can be found. So if you extend your hand, you can't see it on my fat hand, but right in here, you'll see that little indentation. Skinny hand, you can find it right between these two tendons. That's where your scaphoid and your anatomical snuff box is, right in there. UCL of the first MCP means the ulnar collateral ligament of the first metacarpophalangeal joint. Remember, your MCP joints are your knuckles. So the knuckle in your thumb, your first MCP joint, on the ulnar side, right in there. It's not this webbing, it's not in there, it's right on the ulnar side of that first MCP joint. So right in there, that gamekeeper's thumb. SC joint, remember sternoclavicular joint, one on each side of your sternum where your clavicle joins into your sternum. And your clavicle is obviously your collarbone as it comes out into your AC joint, a acromioclavicular joint. Distally out here, a little indentation. Then you go a little bit farther and you'll feel your acromion process. Your acromion process then extends posterior into the spine of the scapula as it goes towards the posterior side of your scapula. And then GH joint is just your shoulder joint, glenohumeral joint. Any questions?